Hi there, it's your general practitioner, Dr. Yvette, and today I wanted to talk about influenza. As some of you may know, we currently have an influenza outbreak in Zambia. So, what is influenza? Influenza is a virus that affects the respiratory system. So, basically, this system is the breathing system. So, it involves your nose, your throat, your trachea, or your windpipe up to the lungs. So, any of these can be affected by influenza. So, we have four main types of influenza. We have influenza A, B, and influenzas C and D. So influenza D is found in animals, so it doesn't affect humans. What affects humans is A, B, and C. So C will affect children and normally causes mild symptoms. I mean, it can also affect adults, but usually, yeah, mild. Then influenza B also affects humans, and influenza B can cause a pandemic. Then we have influenza A. Now, influenza A is the most interesting of them all because not only does it affect humans, but it can affect animals as well. So it's been found in pigs, it's been found in birds, in whales, in horses, in seals, different types of animals. Now, because of this, influenza A causes severe illness because it's always mutating, it's always changing. Because it's found in so many animals, there's always this genetic mixing. Now, if you remember, in 2009, we had a pandemic, and this one was being called swine flu. Now, they were calling it swine flu because part of the genetic makeup of that particular virus was also found in pigs, so hence the name swine flu. Now, I'm sure most of you are wondering why we keep on having pandemics from influenza. Now, because it's always changing, immunity is very, very specific. So once you're exposed to a particular influenza and you build immunity for that influenza, that genetic makeup, it means your antibodies, the antibodies that you produce, will only be effective against that particular genetic makeup. Now, if the virus undergoes this genetic mixing and whatnot, and its genetic material now changes, it means your antibodies, the ones that you've made from previous infections, will not be effective against this new genetic material. So that's why we keep on having pandemics. And in developed countries, they actually have the flu shot. They get the influenza vaccine. So this vaccine, they get it every year because this virus is always changing. So they understand this, and every year they update the vaccine and they give it to high risk people. For example, they give it to pregnant women, they give it to people above the age of 65, they give it to people who work in healthcare, people who take care of babies, people who take care of the elderly, yeah, among many others. So, how is influenza transmitted? Now, influenza is transmitted through air droplets. So, basically, talking to someone who's infected, or when someone who's infected coughs or they sneeze, basically, if you breathe in those air droplets, you can get infected. And if someone who's infected sneezes or coughs on an object and you come in contact with that object and you touch your face, you touch your mouth or your nose, you can also get um, infected. So, what are the signs and symptoms of an influenza infection? So, you can have fever and chills. So, you feel cold, you feel hot. Then you have a cough, you can have a sore throat, you can have flu symptoms, nasal congestion, chest pain, difficulties breathing. Some people may actually complain that they're feeling this heaviness, or like something is compressing on your chest. In children, you may also notice that they are vomiting, they have diarrhea, and because of this, they'll become dehydrated and they'll just be lethargic and not active. Yeah, you can notice that. And it can also cause severe infections. So you may even end up being confused. And some people may end up needing oxygen, like supplemental oxygen, because they cannot breathe on their own. Yeah, that's how bad it can get. So people at risk of getting severe infections are people who have underlying lung conditions, they have underlying heart conditions, asthmatic people, you have diabetes. If you are immunosuppressed, for example, if you're undergoing chemo or you're HIV positive, you're at risk of developing a severe infection. Even in like pregnancy, you're at risk. If you're obese, you're also at risk of getting severe infection. So how do we treat influenza? So for mild cases, we usually just advise you to rest and to take a lot of uh, fluids, and you also have some vitamin supplements, and you can also take things to help soothe your throat like a cough syrup or lozenges. You can also take some vitamins. Yeah, that's in mild cases. But in severe cases, when you come to the hospital, there's some antivirals that are available that are given. Well, I'm not very sure if those particular antivirals are readily available in Zambia, but there are some antivirals out there that are meant for influenza. And if you need oxygen, then we give you oxygen. And the thing with influenza is that sometimes it can cause a pneumonia, and you may also end up having a superimposed bacterial infection. So you have the virus, yes, but you may end up getting the bacterial infection on top of that viral infection. This is the only scenario where you are allowed to use antibiotics. Influenza is a virus, and we don't use antibiotics. So it's only when someone has a viral infection and a bacterial infection, then we use antibiotics. Otherwise, there's no role for antibiotics. Then the other thing, if you're home and you have this mild influenza, you can also get something to help with the fever and the chills. You can get some paracetamol over the counter that will help you. In terms of prevention, our friends have the luxury of having vaccines, but we don't. So wear a mask when you're out in public. Avoid sick people. You hear your friend has a flu and you want to visit them, you may just end up getting it yourself. So avoid sick people. Uh, Wash your hands on a regular basis with soap. If you don't have, you can use hand sanitizer. Disinfect surfaces that are touched on a regular basis. And if you are sick, if you have a cough, please just don't cough carelessly. You can cough into your elbow or you can cough into a handkerchief. Yeah. So this was Dr. Yvette. Don't forget to subscribe to Health with Dr. Yvette Masaka on YouTube. Bye.